All right, can everyone see my screen? Okay. All right, welcome everyone. This is the 8th and final session of the Adolescent HIV Prevention Echo. It's hard to believe that this is our last session, but I hope that you've enjoyed this and benefited from this as much as I have. It's been wonderful to talk with you all every month, and I feel like we've been so lucky to have such a wonderful set of faculty and participants. So thank you for sticking with us, and I hope that you've benefited from it. All right, so our agenda for today. So today is going to be the second part of the presentation from Justin Smith. So we're going to be continuing the conversation from last month about social determinants of HIV risk in LGBTQ adolescents. And Justin's going to talk about some of the proactive, practical, strengths-based things that providers can do. We want to make sure that we end on a positive note, and that we're really giving providers practical tools that you can go and take into your clinic. So we want to end this project making everyone feel empowered to make a difference. And then we're also going to have 2 case presentations. Betty Blackman from Clinton Middle Health Center in Louisiana, and Karen Jaros from Arthur Hill High School in Saginaw, Michigan. So just a reminder about CEs. We will have the slides and the recording posted of this session to Moodle by tomorrow. And as you know, this is part 2 of a 2-part content module. So you can only miss 1 live session in order to receive credit. If you are on live right now, but you missed last month, you can still go in and on Moodle and watch the recording from last month's session and write a reflection. So we've left the forum open. So if you were not here last month, go and do that and you can still get credit. And then another reminder, we are going to do an evaluation post-test. So if you remember, you did a pre-test before we started, and then you also completed a midpoint evaluation. So the post-test is going to measure knowledge gained related to the content covered in the second half of these sessions, because in the midpoint, we asked you about the first 4 sessions. And we're also going to give you an opportunity to provide overall feedback on this project, how we can improve for next time. So this is your opportunity to really share your experience of this project. It's really important for us. This is the first time that we've done a project like this, and so we want to make sure that next time it's better. And we know what worked well for you and what didn't. So please take the time to give us your feedback. I promise it will be brief, shouldn't take more than 5 or 10 minutes. And I will post that to Moodle within the next couple of days and let everyone know when it's posted. And with that, I am going to pass it off to Justin. So Justin, you can take over.
All right. I think you have to stop sharing first.
Right.
So.
Got it.
Excellent. Well, thank you so much. I'm really excited to be able to be the final of the speakers for this year-long exercise that I've really enjoyed and learned a lot as well. All right, let me see. Okay, now my computer. Okay, can you all see my, right now it doesn't want to work. Can you all see my slide deck here? Is my screen up? Because
yeah, we can
see it a little bit. Okay, great. All right, well, thank you all so much. And so today I'm going to dive in and continue the conversation that we started last month with thinking more deeply about the social determinants of HIV among LGBTQ youth. And I think that one of the things that Suzanne pointed out is really want to be thinking more concretely about what folk working in school-based health centers can actually do. And so I want to focus more on kind of that piece around what are some of the action steps that we can take to make sure that we're doing all that we can to protect the health of the youth that we serve. So, what I hope that you'll be able to do by the end of the session is that, again, we can deepen our understanding of some of the factors that we know can protect the sexual health of LGBTQ youth. And then, most importantly, think about what are some of the action steps that you can take as providers in your role as providers in school-based health centers. So, and so I'm hoping that, we can be interactive and have a dialogue about this, because I know that there are folk who have experience in doing some of the things I'll talk about. And so I'll be calling on folks to sort of share from their own experiences to really enrich our conversation. So, what I hope to do in our time here this afternoon is I'll do a brief recap of what we talked about last month, and then talk a little bit about, some of the things that we know are protective in terms of the sexual health of LGBTQ youth, and then dive really into action steps and dreaming and thinking together with all of you about what folks can do. And throughout, I want to pause for question and dialogue, but we'll have some focused time to talk about that at the end of the slide deck. So just as a quick recap of what we talked about in last month's session, we offered sort of a definition of the social determinants of health, which we know are kind of all the things that we know go into shaping someone's sort of health that are not necessarily rooted in factors in the healthcare system. So it's a framework for helping us think more deeply about, what are all the things that influence someone's health status. And so, that's kind of the lens that we're taking, which I know for many folks can be hard if you're working kind of one-on-one with patients every day, to think about that kind of broader context. And what's even more challenging is to think about what you as an individual provider can do about, someone's food insecurity or someone's homelessness, or some of the other things that we know are going to impinge upon someone's ability to be healthy when you're kind of working in that more one-on-one environment. So we know that that can be challenging. I also offered up two different frameworks for thinking about social determinants. So the first was intersectionality, which really is a way to kind of understand how someone's, the multiple facets of someone's identity can converge, and more importantly, how those intersections can then influence their health status. I then offered up a conversation around syndemics, which is really a way to kind of understand how multiple epidemics intersect with one another and how that intersection actually can worsen the outcome. So specifically, we talked about the syndemics of childhood sexual abuse, intimate partner violence, and HIV, and sort of how those intersect and kind of make each of those outcomes worse. I then offered up a conversation around thinking about one particular facet of social determinants. So thinking about networks, and specifically sexual networks, as a determinant of HIV for young MSM. So that was kind of what we did last month. So what we're going to be doing now is moving more away from kind of these theoretical frameworks and more into what is practical and actionable in terms of what we can do within the context of a school-based health center. So I did want to take a little step up and think about what are some of the things that we know can protect the sexual health of LGBTQ youth. And I was trying to think about what would be helpful for us to kind of zero in on. And a lot of the work that we know out in the literature focuses on supportive relationships. And some colleagues at CDC did this really awesome review where they looked at kind of supportive relationships in a variety of domains. So thinking about the relationships with peers. So thinking about how peer norms around condom use, for example, can influence people's HIV risk and sexual health, peer norms around their connectedness to other youth their age, and also social support from other youth. And we know that those are all things that can be protective of the health of LGBTQ youth. Importantly, parents are also a really important piece of this. We know from across sort of the health spectrum, when we think about both sexual health and also suicide prevention, we know that family acceptance of their LGBTQ child is really important in terms of a protective factor. And so thinking about what are ways that we can engage with parents and make sure that, parents also have the tools to kind of understand the lives of their LGBTQ children, because we know that if you have family acceptance, that's going to be really protective in terms of their overall health and well-being. We also know that relationships and supportive communication with sexual partners. So when we talk about partners in this context, we're talking about dating, sexual, and romantic partners of LGBTQ youth. And we know that sort of empowering young people to have those conversations with their sexual partners about how to, engage in safer sexual practices around condom use. This study was done before the advent of PrEP, but thinking about how PrEP can also be part of those conversations around how we protect young people against HIV and making sure that young people have the tools to have those types of communications with their sexual partners. And then lastly, and this is, I think, really important for thinking about kind of where you all come in as providers and school-based health centers, we know that communication with providers, healthcare providers, is also critically important in protecting the sexual health of LGBTQ youth. And specifically what they called out in this particular review article was thinking about specifically communication around HIV testing and the offering of HIV testing. We know that oftentimes, youth may be reluctant to ask their providers to have a test done, but we know that if you as the provider are taking the step to kind of take the first step to ask the question and to offer that, that makes a huge difference. So I think, I lift these up as I think these are all domains in which you as providers might be able to kind of think about how you can have some influence. And so, some of the things you can also think about are what are some of the specific strategies and tools that we know work. So, so much of what we've done in LGBTQ youth research is thinking about what are risk factors, right? And so we're seeing a shift in the field kind of say, we've kind of done this enumeration of all the things that we know place youth at risk, but we want to flip that on its head and think about what do we know can promote resilience and strength within these youth. So a lot of the field is really moving more towards what we call strengths-based counseling approaches. And this isn't exclusive to thinking about LGBTQ youth, but kind of the field of sort of counseling in general is thinking about how can we capitalize and build upon what we know people have in terms of internal strength and resilience. One particular technique that is pretty popular in this domain is motivational interviewing, which I know many people have experience with. But when we think about how do we build that individual capacity within young folks to protect their sexual health, this is a technique that has shown promise. Building on that, there was a case management sort of strategy that was developed specifically for work with LGBTQ youth called Strengths First. And it's a case management strategy that involves several different integrated steps. So, and this was not applied specifically to HIV, but I think the flexibility of this approach is that you can think about it within the context of HIV, but also other types of health needs and health risks. So you begin with sort of an assessment of the young person. So thinking about kind of what are all their risks and strengths in terms of their personal lives, their family life, their school life, and also kind of within the context of their broader community. So thinking about what this could look like in sort of a school-based health center is really thinking about what else exists within the school. So certainly you as someone that works within the context of the school-based health center, you are a resource, right? But what other types of things exist within the broader school environment that you might be able to draw upon? So are there LGBTQ youth clubs within the school that folks can be connected with? What else exists within your community as well? So thinking about if something like that doesn't exist at the school level, what other types of resources can you think about as existing within your community? And we know for those of our partners that are in more rural areas, this can be really tough because there just may not be any resources in the area where you live, specific to serving the needs of LGBTQ youth. And so in that case, it's really thinking about what is this broader network? And so obviously as being part of this ECHO, you have kind of built a network of partnerships with all the other folks that are here. And also thinking what are some of the national organizations that are doing work in this domain, and sort of how can they also be brought in to as a resource. So thinking about organizations like SMILE, which is based in DC, which does a lot of work around LGBT young people, thinking about the Trevor Project, which also helps young folks with around kind of suicidality. And so even if you don't have kind of physical brick and mortar organizations that support young people, specifically LGBTQ young people in your community, that might be something to think about. And also, this could also be an opportunity for you to think about how you might do some advocacy within your local area. So you may not have any organizations that specifically serve the needs of LGBTQ youth, but if that doesn't exist, maybe it's a conversation with the kind of general youth serving community and figuring out, what kinds of support they might be willing to offer to LGBTQ youth in your community. So, that could be part of that assessment process. And then thinking about, what is the goal that you want to set with this young person? So what's this, case plan outcome? So is it that, you're trying to come up with a plan to make sure that they stay HIV negative, right? And so if that's the outcome, what are the different domains and strategies that you can employ to make sure that happens? It may be around some other type of health issue. So we know that for trans youth, thinking about what does a transition plan and sort of how do folks get resources around that. So it's really setting that individual plan with the young person that you have in front of you. Doing that linkage to other resources and services. So, if you're not necessarily in a position to offer PrEP yourself, for example, thinking about who in your community is doing that. If you're not offering hormones for trans youth, thinking about kind of who in the community is doing that. And making sure that you know kind of what is available in your local area to do those referrals. And then, as I said, I think part of our work can be thought of is that when we know that the resources don't really exist within our community, what types of advocacy can we do to make sure that those resources are developed for young people in our care? So if your school doesn't have a specific organization that works with young people that serves LGBTQ youth, thinking about what would need to take place for that to be created, and looking at kind of what's in your community and figuring out like if these resources don't exist, how can, obviously you have a day job where you're focused on sort of providing health services for these young people, but are there ways that you can think about being a partner with other people that are trying to serve and meet the needs of these young people in your community? So again, just drilling down more into what you, in your role as a school-based health provider, can do. I really want to stress this first piece, and that is, serving as a supportive adult. So we know that for LGBTQ young people, particularly those that might be experiencing suicidality, if they have even just one supportive adult in their life that they can point to who is supportive of their identity, that lowers their risk of suicide, right? And so we know that having a supportive figure, and it may not be someone that's in the home, right? And so for many young people, their parents may not necessarily be that supportive adult, but you can provide that role, of being someone that can listen and can affirm them in their identity. And that is so crucial to, not just being protective against, HIV specifically, but just for them having a overall kind of positive health trajectory. So, and again, it sounds like a very simple thing, but I really want to stress how important it is for young people to feel, particularly LGBTQ young people, to feel like there are adults in their lives that care for them and support them as who they are. And if you as a provider in a school-based health center can be that adult or one of the constellation of adults that provides that and serves that role and that function, that is incredibly important. Another thing that you can do as a school-based health provider is undergo some type of cultural humility training. And so, obviously as being part of this ECHO process, you've already begun that process of kind of learning more about what it means to work in partnership and what does it mean to serve LGBTQ young people. But there are other types of trainings that folks can access out there. So a really popular one that is really big on kind of college campuses is called Safe Zone. And so that might be something you think about having you or your staff go through. There was a study that came out just yesterday, actually, where a researcher out of the University of Pennsylvania did secret shopping in different HIV clinics in Atlanta, Philadelphia, and in Houston. And so had young gay men go and sort of try out these different testing centers. And so much of what the study found, and again, it's not necessarily rocket science in terms of the findings, but what was powerful was how important it was for folks to feel like they were in a place that supported them and affirmed them for who they are. And so, and that was from, the front desk on down. And so if, you're in a situation where you have other staff other than you that are kind of interacting with young people, if you as the provider are, amazingly competent and amazingly supportive, but, if the person that kind of greets the young person as they're coming in isn't, that can sort of have a negative impact, even if you are providing high quality care. So it's really important for the entire environment that's created in your center to feel like it's welcoming. And so that's just an important thing to be thinking about, not just you as a provider, but everyone that kind of works with you. And that can be achieved by, just little things that signal like, hey, this is an important space. And so thinking about, what your signage looks like, thinking about what types of brochures and literature that you have, strewn around the center to make sure that, it feels like it's a welcoming and supportive environment for the young people that you're serving. And again, many of you know that already, many of you are doing that already, but I just want to kind of reinforce that point of how important it is for a space to feel like it is a welcoming environment to LGBTQ youth specifically. So do you have signage? Do you have posters that reflect the diversity of the young people that you're serving? Do you have magazines that kind of speak to their needs? And making sure that your staff are welcoming and friendly. And again, that's not earth-shattering, but it is so important that people do that well, because when it's not done well, young people notice, and that really colors how they perceive, kind of the whole battery of services that you're offering. So the other thing that I wanted to kind of stress is that we know that when we think about things as complex and multifaceted as dealing with the social determinants of health, a lot of that's not going to be within your purview as a school-based health provider, right? You may not necessarily be able to do anything about, again, someone's food insecurity, but you might be able to know, what, if this young person is hungry and that's why, they're having so many challenges, focusing in school, knowing where, you can get a referral to kind of food services or a pantry or something like that that exists within your community. And so a lot of it is thinking about what are some additional resources that I can have at my fingertip to make sure that I'm able to provide resources, even if, I'm not going to be able to sort of do that myself. Who else can I partner with that would allow me to offer that service? So really this conversation about how do I, as a school-based health provider, develop these strategic partnerships with other organizations that are hoping to serve this population. So thinking about both locally and nationally, so thinking first locally, who are the other organizations in your community that are already serving LGBTQ youth? Who else is doing HIV advocacy and services? So coming up with that list and making sure that if there's something that falls out of your scope, that that, hey, there are these other resources that I can, bring to bear and help this young person that's here before me. So, so doing your homework on kind of who, and again, I think specifically thinking locally, like who in my community is doing this work that I can partner with. And as I said before, sometimes, particularly for our partners that are in more rural settings, I think, that can be a challenge in terms of thinking about the specifics of LGBTQ work and HIV work, because those organizations may not necessarily be close or nearby. And so then it's thinking about kind of who are the folk on the national level that I might be able to kind of partner with and think about who can help me. But I think also going to the next level of thinking about if youth serving organizations that are local, that are in your community, are not sort of welcoming or not serving the needs of LGBTQ youth, how can you have a conversation with those organizations and say, hey, we're seeing a lot of queer identified young folk in our school, in our program, and they don't have anywhere to go. Is that a conversation is that a service line that you as an organization that serves youth in my community broadly would be open to having? And so that involves a little bit of kind of advocacy for the young people that you serve. I want to pause here and just, I kind of delineated sort of the importance of LGBTQ and HIV advocacy service providers, but for you all that have been doing this work, what other types of partnerships have proved successful and have been fruitful for your school-based health centers that we might be able to kind of name and just surface? And, you can either chat them in, or if you want to unmute and say kind of who else has been a strong partner for you. That can be for anyone on the call. Seeing some chat stuff. So youth homeless centers, yes, thank you for that. That's really, really important. So we know that LGBTQ youth are more likely to be homeless than straight youth. So I think it's important that we build those partnerships where they exist. I know those tend to be features of more of our urban centers, but even in urban centers, that can be a challenge. Just speaking from the experience here in Atlanta, we have one organization that does provide supportive housing for young people that are LGBTQ, but it does have a kind of small capacity. So that's a big challenge for us here in Atlanta. And I know that that can be a challenge for other people, but I think that's really an important partnership to want to build. We've also seen someone else talked about juvenile justice. Yep. So that's a really important, thank you for that. Let's see who else people are naming. So yeah, thinking about how do we build stronger partnerships with foster care services, Department of Youth Services, great, that's amazing. I'm seeing departments of health. That's important. We know that oftentimes, particularly in rural areas, the health department really is kind of the main provider of anything related to health. And so how can we make sure that they're also providing competent care for LGBTQ youth? Yep, great. Yeah, these are really wonderful ideas and important partnerships to surface and to think about how we build with. Thank you for that. So again, as I talked about earlier, sometimes, when we think about something as daunting and as large as addressing social determinants of health, a lot of times we have to sort of move beyond our individual roles as clinicians and think about kind of this higher level of policy and legislative advocacy. So something that has been a challenge, particularly for those of us that live and work in southern states in particular, is this issue around making sure that our schools are providing comprehensive, medically accurate sexual health education, and that is inclusive of LGBTQ youth. And I think that that is an area where you as providers can have some particular sway. And I know that oftentimes your job roles may prevent you from kind of directly lobbying and advocating, but I think where folks can do is education. And so think about how you might be able to educate your elected officials or other policymakers in your community around the importance of making sure that you do have access to this type of sexual health education within the school context. And given your expertise as school-based health providers, you really have an ability to speak to that quite powerfully. And again, I want to emphasize and stress the importance of building these partnerships with other youth servant organizations within your community. And so oftentimes there may be sort of a policy or legislative agenda that these organizations might have. So kind of understanding, what's on that agenda, understanding to what extent health can be included in that. And, just thinking about, are there ways that within your role as a school-based health provider, you might be able to support that type of advocacy work. And again, recognizing that there may be restrictions on sort of how that's done. But I think what's important to name in this is thinking about what that could look like. Because I think, these partnerships are really key, because we know that, you as an individual provider may be very limited in terms of the power that you hold in terms of addressing some of these broader social determinants, but as part of a larger collective, those things can be made possible. So with that, I wanted to just sort of surface or kind of understand and hear from folks on the call about what types of successes folks have had, what types of challenges folks have had with doing either policy or legislative advocacy in the past. I know, the experience in the room ranges on that, but I wanted to try to surface if folks wanted to lift up any examples of things that either worked really well or lessons learned from things that didn't quite go as well, or just kind of where folks have experienced doing this type of work. And folks can chat that in, or if you want to unmute yourself and just name activities. So.
Justin, I just wanted to share from the national perspective. We've heard a number of stories from providers across the country who they may have felt like they couldn't be the ones to speak up at the school board meetings, et cetera, but they prepared and empowered the youth to be the ones to speak at the school board meetings, et cetera. So really kind of helping to center the youth voice. And that kind of gave them a little bit of protection too, if the providers felt like they were kind of in an awkward position to advocate for those services themselves. So we've heard a number of stories around the country where that has been successful and it's actually changed policy. So just wanted to throw that out there.
No, thank you for naming that. I think, and that's, I love that idea and that as a strategy because it actually serves a number of important purposes. So we know that, obviously if the goal is to move the needle on a particular type of policy that impacts young people, having young people advocate on their behalf certainly is, compelling in the fact that you've seen movement because of youth advocacy, speaks to that. I think also just as we think about kind of what we know are protective, so giving self-efficacy to be able to advocate on their own behalf also has tremendous positive health benefits. And so if people feel like they are in control, we know that is a good thing. So I see kind of multiple benefits for going that route. And then also just kind of setting them up for a kind of career or have the ability to sort of speak up for their own needs. And I think that is really, really critically important. So thank you for naming that as a potential strategy. So what else has worked for folks, or where else have folks experienced challenges in doing this type of work?
Oh, am I muted?
Yeah.
Can you hear me?
Yes, we can.
I think one challenge for us as being affiliated with the University of Michigan is the limitations that we have and what we're able to do as employees of the university as far as doing things like advocacy. And I think Suzanne's point is definitely one strategy that we have found works and recommend. And also, I think we are also are always kind of trying to sort of like figure out where the line is between advocacy and education and providing information. And so that's been something that organizationally we've really had to grapple with and tried to really, we do want to provide good information and facts and research and data for policymakers to be able to make educated decisions. And so that's kind of an approach or a strategy that we've tried to employ.
Thank you for naming that. I think that, I also want to lift up that even in a sort of an educational standpoint, speaking from your experience as providers is really, really powerful. So I think that kind of owning and knowing and being able to share your own story about what you're seeing in your clinics every day can be really compelling. I mean, I'm really always amazed at the importance of storytelling and narrative and how that can shift conversations. And so, so whether that is, kind of sharing your own story, whether that is empowering young people to be able to share their stories, I think those are all kind of critically important pieces of how we can move conversations around these domains forward. Well, great. Well, I just want folks to kind of reflect on that and think a little bit more about what that can look like for them, given that everyone's context is a little different in terms of what their job role restrictions might be. But I think it's important just to think broadly about kind of education and advocacy as sort of strategies to move the needle on LGBTQ health broadly.
Can I add something real quick?
Absolutely.
So I haven't really been a part of anything directly working on policy, like on a government law level, but I've been a part of a few working groups to help strategize on how to be less punitive with youth and more, seeing kids, most of it has actually been around minors doing sex work, which is, technically considered trafficking, and how to see those youth as young people that are in need of services instead of kind of involving them with the juvenile justice system, and that, it's a little complicated based on where you are and what the laws are. But one of the most interesting ones that I was on was specifically about boys who were found to be doing sex work and being sexually coerced, and how boys are more likely to, for people to assume that there's a consensual aspect, even if they're minors and it's technically illegal. So, those kind of working groups involved like many different organizations, including like police officers and juvenile detention, where we all were trying to strategize together. I will say that was in Boston, where, it's a little bit more of a liberal state, obviously, but I think that those working groups can be super helpful to try to find a way to be a part of those if there are any conversations happening like that about young people, to be a part of those conversations, because I think always there should be a clinician voice in those conversations. And then something that happened in Boston that I wasn't a part of but was really cool, and a lot of healthcare providers were a part of, was a push to distribute condoms in public schools, which up until 2015 was illegal, not illegal, but it was against the rules in public schools, even in Boston. And there was a big push by the nurses actually in the school-based health centers to distribute condoms. And then when that was pushed through, the nurses organized a workshop where kids could design the condom wrappers. And then a few people, then there were 10 winners, and the condom wrappers, there were 10 different wrappers. And that was a really amazing initiative that was really spearheaded by school-based health clinicians. And I wasn't a part of it, but I kind of got to witness it. And we had those condoms at our center, and the condom wrappers were really cool, and the kids designed them. So I think that was a really cool example of, how the power that school-based health clinicians can have within the public school system, which is such an important institution for so many kids who are kind of on the margins in various ways.
Thank you for lifting that up. That's a really great sort of example, and it leads me to think about an example that happened here in Atlanta, kind of a similar situation where there was a youth roundtable that was specifically convened to deal with health issues. Started kind of as sort of a specific organization to deal or address HIV among LGBTQ youth, but it kind of morphed into this broader coalition to address a lot of different, health challenges faced by LGBTQ young people here in the city, and really focused primarily on youth homelessness. And so it was important that we did have clinicians at the table to sort of, bring their perspective. And so these types of roundtables and convenings where folk are working collectively on kind of broader issues that are related to LGBTQ youth can also be a space where you can plug in as a provider and really bring that story and that narrative of what you're seeing to kind of shift the conversation. All right. So,
Dustin, sorry, just have one more thing I wanted to add. I just wanted to jump in, and I will enter the web address on the chat box, but we have a tool at the School-Based Health Alliance. It's not specific to HIV prevention or even LGBTQ youth, but it's really about promoting health and wellness in the school generally. It's called the Hallways to Health Toolkit. And even though it's not specific to the populations that we're talking about right now, I think there are a lot of good tips in there about how to connect resources outside of the clinic. So resources within the school, outside the school walls. There's a lot of policy stuff in there. And a lot of the things that we're talking about, comprehensive sex ed, condoms being available, a lot of those are decisions that are made at the local level, at the school level or at the district level. And there are people sitting on panels and boards who come up with those recommendations and things like that. So there are a lot of tips in there about how to connect with those groups, wellness committees, etc. So I'm gonna put that link up there, and I would really encourage you to explore it, even if does not have a lot of useful information with this content. I think you could find it helpful in general in your work in the school-based health center. So I just wanted to promote that as a tool that we have that might have some helpful tips in there.
Great.
Can you all hear me? This is Renata.
Yes, we can hear you.
Can you hear me?
Yeah.
Yes, we can hear you, Renata.
I don't know. There are a couple examples I was just going to provide. I know typically there's a local American Academy of Pediatrics. We've partnered with them here, and through those opportunities, I had a couple opportunities to go and testify around certain laws and legislation that are impacting adolescents, whether it's sexual minority, gender minority adolescents, or advocating around HIV testing or comprehensive sex ed. So I think they're always looking for people that are on the ground to be able to advocate, to go and testify and provide that personal experience. And sometimes sometimes I find this helpful, is to just have a one-page sheet that has sort of some information about what the background or the burden is, and then some information about what policymakers can do. And they're always willing at the state level to meet with people on a one-to-one basis. We've taken residents and medical students in Annapolis, as well as some of my colleagues have organized days in DC. So, people are really open to meeting with individuals. You may meet with their staff, but at least you do get on their radar. The other thing I would say is that both Advocates for Youth as well as SchoolBased have resources around advocacy, particularly around efforts in schools and how to expand school health education in various settings.
Thank you for that, Renata. So in kind of keeping with the fact that, sort of this is the last of our kind of echo sessions together, I wanted to kind of take a step back and think together about sort of what, after going through this whole year of these conversations and of developing tools and skills in how you can work better with LGBTQ young folks, thinking about what types of additional supports or resources you might need or want to see developed, and thinking deeply about kind of what some of your learning needs may be beyond kind of what we've accomplished together. And then, just kind of what and how do you envision kind of applying the knowledge that you've gained over the course of this year to your work specifically with LGBTQ young people in the future? And I know that those are big questions, but I'm wondering, if anyone wants to kind of offer up their thoughts on kind of any of these three domains, and because I think that would be helpful in terms of the next iteration of this ECHO project. So I want to just open the floor for responses to these questions or any other questions that you had for me about kind of action steps. And I know that some of these questions were captured in the overall evaluation, but I did want to just hold space for folks to offer thoughts. So, I think I love that question. And so just thinking about how do we stay grounded and not get overwhelmed with all the work that needs to get done. Um, so at least my personal take on that is really trying to know that this is kind of a long game. And so to know that the changes that we want to make, and we want to make sure that we're doing our best to serve these young people that are coming to us. We know that there are lots of obstacles and challenges, and we also know that they're not things that can happen overnight. And so knowing that this is kind of a long game, and I think for me that's what kind of helps keep me grounded in it, is like I'm not going to be able to eradicate homophobia tomorrow, right? But I know that by taking kind of small actions and speaking up in a meeting about why it's not fair that LGBTQ young people don't see themselves reflected in their sexual health curriculum, doing that will create the future that I want to see. And so knowing that these things are not going to happen overnight, I think, and just being committed to this longer process. So I know that, there's always a lot of things coming at us, but I know that if we think about it as that, we're not going to get this done all in one day, but that this is sort of a longer process. I think for me, that helps kind of remove sort of the sense of dread and overwhelmingness with kind of all the things that we have to do. So, so that's at least one way that I would respond to that. But I know other people may have other ways of approaching or thinking about that, but that's a really important question.
So Justin, an observation that I have had is that, and I see this a lot with our field across the country, is that because school-based health center providers are very rarely actually coming from or employees of the school itself, they're run by an outside sponsoring entity. In many cases, they're not as well integrated into the school as they want to be and as we would like them to be. And so a lot of the things that we're talking about, whether it's, hunger issues or learning disability evaluations, or, a lot of the things that we've talked about over the course of these sessions, there are people within the school who are resources, who are working on those things. But in a lot of cases, providers in the SBHCs, they're not connected with those staff. They don't know who's doing what. So I think a big challenge is making sure that the SBHC providers are better connected and well integrated with the other staff in the school who are working on these health issues and broader issues, because there are resources within the school. It's just a matter of figuring out who those people are and how to connect with them. So that's something that seems to me like there's a big opportunity to kind of bridge that a little bit better.
Yeah. No, absolutely. And then that goes back to what I was saying earlier around kind of how do you build connections? And so as internal to the school, right? And so so it's really operating at multiple levels. So thinking about what the resources are within your school, how do what are the resources that exist within your broader community, and then also knowing kind of on a national level, what some of those resources might be. So I think just kind of thinking yourself as that you're a provider, but also you can be a conduit to these other resources that young people might need. Well, this is great. I just wanted to move on and just kind of open up the floor for any additional questions before we move into our case studies for this afternoon.
I guess everyone's an expert now.
Everyone
It
is an
worked.
expert.
The echo worked.
Echo
We
worked
solved all your
beautiful.
problems.
We solved all the problems.
Yeah.
Well, wonderful. Well, thank you all for your attention. Back over to Suzanne, who will transition us to talk about and dive into our study this afternoon. Thank you for your
All right.
attention.
Thank you, Justin.